Here we are, the last session of Allied Health Week. My name is Deneen Diamond from the Center of Excellence for Health. I am so excited about today's session, and we are ending with an absolute bang. We have beautiful students that are here from Miramichi Valley. If you folks want to wave, I see some people behind the desk. If you want to wave really quickly, thank you. And we also have the ICE Center here with Miss McGinnon, and we're so happy that you're able to join us today. Really excited for the session. I know very little about radiation therapy, so I know I will have lots of questions. And we're so blessed to have our experts here from Horizon who are offering their expertise and their knowledge and some of their career pathways. So very exciting. So without further ado, I'm going to hand it over to our beautiful experts from Horizon.
Hi, thank you very much. My name is Leslie McLennan. I'm a radiation therapist here at Horizon, and with me today is...
My name is COE McCumber, and I'm a dosimetrist here at Horizon.
So we wanted to talk to you today about radiation therapy. So the first question, what is radiation therapy? So radiation therapy is the use of extremely high energy X-rays for treatment of cancer. So if you think of a regular X-ray as being sort of in the kilovoltage, the 1000 voltage range, these rays that we're going to use are more in the mega voltage range. Radiation has been used for over 100 years to treat cancer, but we are doing it very specialized and very advanced here in St. John.
That's right.
So radiation itself, you may have heard a few terms that go around it. Radiation can either be radical treatments or palliative treatments, just depending on what patients' diagnoses are, what their goals of treatment are. We can use the radiation to cure the cancer, to treat the cancer, or we're using the radiation to help relieve their symptoms, to give them a better quality of life as they're moving towards the end of life. Radiation can be used by itself in treatment. It can also be used with surgery, with chemo, with immunotherapy. Modern cancer treatment is a combination of multiple different treatments, and we're just sort of one section of what a patient might see. So how does radiation work? Okay, so I'm going to blast them with an X-ray. What's that really going to do? So if you decide to become a radiation therapist, you'll spend a whole year learning the answer to this question. The basics of it is that as the radiation is passing through the body, it's depositing energy. And that energy that it's depositing is going through the cells, it's hitting the DNA, and it's breaking up those chains and breaking open the DNA. And when the cells go to divide, they hit the broken sections on the DNA. They don't know how to repair. They don't know how to deal with the broken bit, and the cell basically just explodes. And so that's how we prevent the cancer from growing, and it's how we kill the cancer they have. So who works in a radiation department? You have radiation oncologists, those are the doctors, dosimetrists, those are like Corey, who do all of our planning, radiation therapists who deliver the treatment, we work with the patients.
Like Leslie.
Like me. We have medical physicists. They do a lot of work around our machines to make sure everything we have is safe. And we also have nurses in our department. Yeah. Radiation does cause a lot of side effects. Cancer patients have a lot of medical issues, so we need to have a lot of support for our patients. So, someone you love, someone you know, they've been diagnosed with cancer. What happens? You come to the department, you meet with the doctor. You're going to discuss your treatment goals. You're going to talk about what the options are, and the doctor will prescribe a radiation, if it's appropriate, very similar to the way you prescribe medication. We want to give you a certain amount, and we're going to break it up over so many days so that the body can handle what we want to give it. And then once they have that, the patient will move to what we call a simulation appointment. We have to figure out how we're going to give this amount of radiation to a certain body part, to a certain place, without causing too much damage to every other part of the body. Because radiation can be very damaging. You know, it is dangerous sometimes. So we have to make sure what we're delivering is going to the right place, only the right place, and not hitting anything important on the way by. So at that, we'll talk more about the simulation appointment, but it's basically just about getting the patient ready for treatment. Then they move through to dosimetry, the area that Corey works. That's where we create the plan and the math, figure out the angles, get all the juicy physics of what we're going to do.
All the nerdy stuff.
The nerdy stuff. After that, because this is so dangerous, we also pass it through another step. Every bit of math, every bit of the plan is double checked, it's reviewed. We have to guarantee that the machine can physically deliver what we've just told it to do. And the very last step is the one where the patient joins us again and we actually deliver the treatment. And depending on what they're set up for, that could be done one time, it could be done 33 times over the course of 6 or 7 weeks. It all just depends on how the math works and what's best for them and their disease. So simulation, how do we actually deliver radiation treatment? If you look up on the screen there, you'll see multiple different pictures. So in the top, we have someone sitting in the little blue cushion there. We have these almost like bean bags. They're soft and fluffy bags that our patient's gonna lay down in. They're gonna get nice and comfortable. Radiation treatments take about 20 minutes. And during those 20 minutes, the patient cannot move. Not even a little bit, not a cough, not a twitch, nothing. So we need them to be nice and comfortable, so they're not going to move. So we make these little beanbag cushions for them to lay in. The cushion starts out soft, then we take out the air, it becomes a firm, solid mold that they're gonna fit into every day. Every patient who comes for treatment has different mobility restrictions. You know, we treat everything from young and healthy 20-year-olds, seemingly healthy 20-year-olds, to 90-year-olds that can barely move. And I have to find a way to get them as comfortable as possible that they're gonna be still and stable, so that I can walk away and leave them alone in the room without any fear that they're going to move. The next image down you'll see is we call that a mask or a shell. If we're treating the brain, we have to be incredibly precise. So we use these tight masks that pin the patient down to the bed so that they can't move, and they're accurate down to a millimeter. So that patient can get up, get down, get back in the mask every day over the course of multiple days, and they're always guaranteed to be within a millimeter of where we need them to be. You'll see on some of the next slides, there's ones that have big cushions over their knees and over their chest. Sometimes we have to restrict patients so that they don't move. We press cushions into their bellies so they can't take a deep breath. We press cushions into their knees so they can't twitch or fidget. So we really get their position held still down to a few millimeters. You'll also notice at the very bottom, there's a picture of someone getting a tattoo. We do use permanent tattoos in the radiation department to line people up. So if you're working in the simulation room, you're working as a CT person, you're working as an arts and crafts person building things, you're working as a tattoo artist, and you're working as a bit of a therapist to get the patients calm, comfortable, and relaxed enough to get through the procedure.
And then they move on to dosimetry. And the dosimetrist's job is to actually create, like Leslie said, the plan to give the radiation without damaging all of the tissues while treating the actual disease underneath. And to put it into kind of a perspective, a lethal dose for a person, a whole body lethal dose would be 10,000 millisieverts, which equals out to about 10 gray, and we work in grays, and we give anywhere between 2 to 7 times that amount whenever we give radiation. So it's very dangerous. You can't take it back. So we have to make sure everything is very precise. That's why when Leslie said millimeter accuracy, that's very important. We do a lot of the math and physics and anatomy and radiobiology portion of the work because we have to create what's called treatment fields or beams in order to treat these cancers without treating or overdosing normal tissues like spinal cord or brain stem or things like that, your heart, things like that. So we will go in, and I have a couple pictures here. This is actually the planning software that we use. This is a brain cancer. I wish I could make this a little bit bigger. And if you can see the mouse cursor, this little circle here is the actual brain tumor that we're treating. And you see these lines, they represent where the actual beams come in. So we don't want to treat through any of this normal tissue here. We just want to try to focus on the actual cancer and not treat high doses to anything else. One of the really neat things is we can't make people stop breathing for the 20 minutes. People tend to die when you do that, and that's not good. So you can see over here a lung tumor with somebody breathing. We have to take into consideration that, yeah, that's going to actually move. So if we're going to turn on our radiation beam, we want to make sure it's always in the same spot at the time we give the treatment. So you'll see this little circle here, and what this represents is the big head of the machine, which Leslie will show you in a few minutes. It'll actually travel around the body and give the radiation without stopping. It'll just keep moving. So it'll have to track that tumor while the patient's breathing and we're giving the radiation dose. So it can be a little tricky because if they take too big of a breath, we might miss it, or we might treat something that we don't want to treat, and that is a no-no. This is what's called a whole brain plan. This is a person's head. So the green line represents the radiation that they're getting. That would be the prescription dosage. Their eye would be right here. So because of what slice we're on, you can't really see it, but we're probably about 2 millimeters away from their eye. This dosage would cause those people to become blind if we gave it to them. So that's something that's going to be shielded out. On this side over here is what's called a 4-field plan. So we're giving a beam from the front and the back and right through these two things here, which are your femurs. And this would be a bladder cancer. And we have to treat that without overdosing the rectum, because nobody likes to get problems with their rectum when you give them treatment. So one of the I say one of the coolest things, because, nerdy and all, we can actually shape the radiation around structures. So this blue line here represents the radiation that this person's getting. The redder the color is, the hotter it is. So the primary tumor would be within the reddish portion, and then it'll fade out to green as the dose starts to fall off. And then the blue portion would be what the nodal group or the other portions of this head and neck is getting. But if you see right here, there's actually a spinal cord there. So if we give that too much radiation, that person either becomes paralyzed or they die. Also not favorable outcome for them if that happens. So the machine and the dosimetrists and the physicists have actually been able to come up with ways to bend the dose around a structure so we avoid hurting somebody or damaging some organ in their body. So like I said, the primary dose is the red, and anything higher than 45, which would be outside of this blue, would cause paralysis or death. So we don't like doing that. So we're going to pass it back to Leslie, and this picture of this machine here is what the radiation actually comes out of.
Yeah, so this is what we call a linear accelerator. It's the most common radiation machine. This one delivers what we call external radiation. You'll see up at the top, there's the head of the machine. You can point to it with the mouse.
Yep.
There's the head of the machine where the actual radiation comes out of, and stuck on either side are a KV arm. So if you're working as a radiation therapist, we do use X-rays. So we are qualified to do X-ray imaging as well. Every day we take images of our patients, and we compare those to the images we took on the very first day, and we make sure that our patient is accurate in their position down to a few millimeters. It often means we have to go in with our patient, we're rolling them, we're moving them, we're setting different things around to try and get them in the perfect spot. Because you'll see on the bottom image, there's that beam, that radiation beam coming through to treat their brain tumors. And you can see that if we miss a little bit, those beams are going through eyes, they're going through normal brains. It has to be in the perfect spot as it's going through. Working as a radiation therapist, you need to have a few key skills. You need to have good patient care. You have to be able to convince people to trust you enough to let you do something to them that is potentially lethal and that is potentially very painful. So you have to earn their trust, and you have to be calm and reassuring to get them to cooperate with you.
We have a lot of, you'd be surprised, it's very upbeat. We joke a lot. I've done a cartwheel for a patient before, so if you can imagine somebody my size doing a cartwheel, yeah, people, we try to keep them happy and comfortable.
You have to be their cheerleader a little.
Yeah.
You also have to bring a high level of technical skills. These machines have a lot going for them. You need to understand how everything works. You need to understand how the radiation works. There's a lot of fine technical skills, both with the technology of the machine and with the radiation itself. You need to have good teamwork skills. We work in groups of minimum 2, usually 4, every day, all day. This is not a job for someone who likes to be sitting alone.
Yes.
Okay. And you also have to be patient with education. We are constantly learning. Technology is constantly advancing. You can't just sit down and say, I've learned it, I'm done. Every day you learn something new, whether you're learning something from your patient or you're learning something about the machine itself.
That's right.
Here's a few more pictures of the actual machine. You can see on the top one, there's a picture of how the radiation is made. So it's very similar to how they make radiation in an X-ray tube. It's just a lot more high powered. We accelerate the electrons down the tube. They hit the filament, hit the target, pass through, and come down to treat the patient. We use laser systems to line up all of our patients. So those nice tattoos that we gave them, we use green lasers in the room that we know are a set distance from the machine, and we line up to their tattoos, and we know that if their tattoos are on the lasers, they are theoretically in the perfect spot. And then it gives you an example of what a patient would look like laying underneath that with the lasers on. As we move to the next slide, we have a little video that sort of gives a better description of how radiation might work. Hopefully the video works. So in this video, you'll see a little animation of a linear accelerator treating a patient. So there's the accelerator, there's our little invisible man, and you can see the dot is the tumor inside of it. So the first thing the machine's going to do is it goes around delivering the treatment. So we take pictures every day to ensure that we're always in the perfect spot. In this case, the machine is actually taking a quick little CT slice through that patient. The therapists are going to compare that slice, decide if they need to move the patient, and then deliver the treatment. So you'll see the beam there coming out of the machine, treating the patient, and he's done. With the radiation, they don't see anything, they don't feel anything. It's very similar to when you have a regular X-ray. You know, we've all been to the dentist, the X-ray department, where they take them. Because of the strength of the radiation that we use, we don't stay in the room with the patient. There's no hiding behind a little piece of plexiglass. We have to sit outside the room behind concrete walls. But we're constantly monitoring our patients. All right, so here are a few of our different therapists. How to become a radiation therapist. After you graduate high school, you're going to start at UNB, and then you can apply to a radiation therapy program. Currently, the closest one would be Michigan University in Toronto. And I'm sure if you were to tell Horizon that that's where you wanted to go, they would find a way to help you get there. That's right. We are very short-staffed for radiation therapists. We're always looking to recruit more. It's a great job, Monday to Friday, and the pay ain't bad.
Yeah, that's right. Monday to Friday is the interesting part. Yeah. And to become a medical dosimetrist, you basically have to become a radiation therapist in Canada first, and then you'll do specialty training, and it's about 2 years or so more, and then you get your certificate of dosimetry, and you get to work. Unfortunately, not with the patients, but you get to work a little closer with the doctors and the physicists, and it's a lot of computer time. Yeah, same hours though. Yay.
And if you want to be the big boss and become the radiation oncologist, the one who prescribes the radiation, the one who's ultimately responsible for the patient's treatment, after university, you're off to medical school, residency, and you'll specialize in radiation oncology. Yep. And if you're really nerdy, you can be a physicist. They work more with the machines themselves, with research, and with the math of it all.
Yes.
And as I said before, we do have nurses in our department who specialize in radiation oncology. We're grateful to have them, and our patients are grateful to have them as well.
And that's it.
Does anyone have any questions?
Oh, my soul. I have so many questions. Thank you so much. That was absolutely lovely. And I learned so much. And I do have one quick question, but while I'm asking a question, I know the teachers, if students want to come up and ask questions to the mic, that's great. If you would rather chat them, or place them in the chat, you certainly can do that too. But one of my big questions was around technology, and you really set that up well when you said that technology is constantly changing and you have to be constantly training yourselves. What does that look like, especially like at Horizon? So let's say something changes regarding the machine and maybe the steps that are being taken during the radiation. Is that something that is offered as a professional learning opportunity? And is that something that you have to constantly be maybe upgrading in your portfolio?
Yes, a lot of our machines all come from one or two certain vendors. And so as there's major changes in the technology, the vendors will bring in on-site, they're radiation therapists, but who work for the particular vendor, and they'll come in and they'll do on-site training. So you get to spend a day or 2 days working with that person, and also with, while actively treating our patients. And they sort of sit over your shoulder and tell you, oh, click here, learn about this, and explaining how things are changing and how they're different. We also do have super users sometimes for certain sites. So those would be therapists who've gone away for training on certain procedures or certain bits of technology. And so when they come back, they get to sort of disseminate that through the rest of the staff. Just as you're working with people is a lot of how we do our education.
Yeah, exactly. And I'm sure it's different every single day. If you folks want to stop sharing, that way we would see you in a big
Oh,
screen.
sure.
That would be
Cool.
lovely. And I have some questions coming in from the chat. So it says, what is the current starting salary? We get this question every single session. Students want to know how much money you're making. One, for me, the Monday to Friday piece is like huge. So what is your starting salary in New Brunswick? And also, where can a radiation therapist work in New Brunswick?
Currently, there are 2 radiation therapy centers in New Brunswick. There's the St. John Regional Hospital, and there's also the Moncton Hospital, or the Georges Dumont. So typically, not always, but typically you would get more English patients and more of an English atmosphere in St. John, and Moncton obviously is more of a French clinic. Depending on where your language skills may depend where you want to work. As far as starting salary, it's about 43 for those fresh out of college.
Okay, awesome. And what are the best and worst parts of your job?
The best part of the job is absolutely the patients. The time you spend with someone, that relationship that you build with them, that watching them over time move through their treatment, and maybe it's a positive outcome, maybe it's not, but to just be there and support them during that time. You learn so much from the patients. It's very fulfilling, it's very rewarding. As far as the worst, sometimes that's also the patients having to say goodbye to people can sometimes be the hardest as well.
As with, all healthcare professions, sometimes you have accidents, I've been thrown up on, that's not always
there's
fun.
that too.
But,
Peed on, bled on, thrown up on,
Yeah.
bashed into equipment. Yeah.
So you gotta be a little not queasy, I guess. But other than that, if that's the worst of it, then that's the worst of it.
Agree. Okay, I see Miss McKinnon's kind of typing away, but on another note, with the training that you do, you spoke about getting trained, I believe in Toronto is where you first go. And you spoke about Horizon supporting that. If students were interested in that, could they contact me or contact you, or who would they contact if they really wanted to dive deeper into this career and maybe speak to somebody about what courses they need and that type of thing to make sure they're on track to actually dive into this profession?
Well, I'll tell you right now, we are actively recruiting. We do have an education coordinator here in the department. So if someone wanted to reach out to the oncology department, we would bring them in. They could job shadow with us. They could volunteer within the department to see how things work.
Yep.
You could reach out to our manager. She would love to have a chat with you to help get you on the right path to get you into working here.
Okay. Awesome. So teachers, if you're listening to this, and students, if you're listening to this, probably the easiest way would just be to ask the teacher to contact me, and then I will direct you right to the people that you need to talk to. So that is a win-win connection. I love it. All right. Another question in the chat says, how did you both become interested in this field? Most people would have never heard of this area of study.
Well, that's true. Even when you come into the hospital in St. John, we're kind of tucked away at the back of the building. And most people don't know because hopefully you don't have to go through a cancer treatment, right? So don't take this the wrong way. We don't want to see you, but if you're going to come to us, we'll take good care of you. And that's maybe the reason why people don't really know of radiation therapy, unless you have a loved one who unfortunately has been affected with cancer. And that's how I ended up in radiation therapy. My grandmother was diagnosed with rectal cancer. She knew I liked, technology, and I was very good with people. So I liked the patient aspect of it, and I became interested. Unfortunately, she passed away before I could finish my training. But usually, most people who are affected by cancer find out a little bit through their family or friends. Yeah. Oh, we lost.
I'm afraid we
Oh,
lost the.
There we
sorry,
go.
no, just me muted. I was just
That's-
trying to give you the floor. Thank you so much for being open and sharing that story. We appreciate it. Another question, how long is the radiation therapist program?
Right now out of Michener, I believe it's a 4-year degree, but it's not necessarily straight through the 4 years like other degrees. You have clinical rotations, so you'll go to university for a semester or two, then off to the clinic to work for a semester, and then back and forth. It's very similar to a nursing program in that
Okay.
regard.
Yeah,
Yeah.
perfect.
Yeah, you don't just
Awesome.
get the book learning. They break it up so you get to apply some of the knowledge that you learn with hands-on. Like when you come to the clinic,
You're working.
you're working.
Yeah, and that's what's so beautiful about this program that we're a part of with the experiential learning piece is really giving students an opportunity to have hands-on learning. And we really find, and I'm sure you find with your students that come, the book stuff is really important, and you have to have that knowledge. But when you get there and you actually get to use the equipment and be with the patients and all of those lovely things that come along with your job, that's when you really start to learn about how it all works. So yeah, that's awesome. Okay. I'm just being mindful of time. It's 1:57.
Vinny, can I speak up? It's Mary, the manager who the students would be, you'll put in contact with me. But I just want to make sure that they were aware of the fact that Horizon is looking forward to a return of service. So what that would mean is that if a student was accepted into the Michener program and then Horizon was willing to support them, then they would sign a piece of paper to say that they would come back and work for us for 3 years. So that is something that we've had to put in. We've had it in place before, and it's was removed. But right now, we're negotiating that process.
So you
And
get
that
paid
is
for-
that is oh,
You'd get paid to go to the university, provided you work with us when you get back.
Your tuition and your food and lodging and everything, because we realize that coming from New Brunswick and going to Ontario is very expensive. Manitoba is another center, which is a little bit more expensive too, but yeah. So we're open to those suggestions right now. And if these are grade 12 students, then look us up, see what you need to know before you go to first year university, and then we can talk.
this is like I think I want to go back to school. My goodness. Wow. I tell people all the time I'm almost 50 and I still don't know what I want to do when I grow up. So and this week has been helpful or not helpful for me because I feel like there's so many things to learn, but what a wonderful opportunity Horizon is offering. And really, part of the Center of Excellence is really to showcase the many opportunities that are here in our province, because we want students to know that they can come to New Brunswick or come back to New Brunswick or stay in New Brunswick and get the job of their dreams. And you just mapped it out, Mary. So thank you so much. I'm just going to open it up for any more questions just for one more minute. And I believe we have everybody, teachers and experts around the table today. I know it was a little bit hard getting things set up, but you folks did an amazing job. Teachers, thank you so much for signing in. Some of the teachers that are here today have signed in all week. We are so blessed and so thankful, especially to the teachers in the North who really represented well this week. So whoop, whoop, North. Really exciting to have everybody. All of these sessions are recorded and will be posted and should be shared. So use them with your students next week, in the future for career pathway exploration. Please feel free to reach out to me, and I can certainly direct you to the experts that spoke today, and to the Horizon folks. Unbelievable. This might have been, one of my favorites, just because I really didn't know a lot about radiation. And I loved your picture that I posted on the website and your gear. I thought that was so cool. So I'm going to hand it over to you folks to have the last word, but from the Center of Excellence for Health and from Allied Health Week, we are done. What a long week. It was so lovely and delicious. Thank you so much. Really, really feel lucky to have spent some time with everybody around the province. And I'm going to hand it over to the Horizon experts for the last goodbye.
Thank you very much for having us. It's been fun. It's always nice to talk about our profession because, of course, we love it, or we wouldn't still be here doing it. And yeah, it's one of those things that you kind of think about what do I want to do? What do I want to be? You never really know until you start, but just healthcare is always going to be there. People are always going to need help, whether it's with oncology or other areas of the hospital, nursing, doctors, whatever. Yeah, human beings will always need healthcare, and it's nice to help people out.
It's a very rewarding career.
Yep.
Absolutely. Thank you again so much. Everyone, take time to get outside, enjoy that beautiful sun. And I know that there's weather coming for this weekend, so please get outside, breathe in some fresh air, and always thank the people that are working in the medical field because they are doing an amazing job and amazing things. So thank you so much from the Center of Excellence for Health. Have a beautiful day. And I'm just going to read the comments here. It says, thank you so much. Very informative and much appreciated. Thank you. Great session. So well done.
Thank you.
Thank you.